something that's one-off. And so I'd say what we've done as a city primarily is tried to work together to couple. The commission has a lot of tentacles with people, and they have brought in people that could aid in some fashion and who have made a lot of contributions to help the front line on the healthcare side, as well as our first responders. We're gearing up to be able to produce 3 million masks a week. Wesley Beck is attempting to do that from idled equipment that he has, and which will be wonderful to be able to get that done. And they're having good success in that regard. The ability and concern that we have to kind of think about as we go forward is that as the state gets hotter in terms of cases, if we as Polk County stay a little cooler in the number of cases, at some point in time, we may have to take some state sharing from Orange and Hillsborough County, maybe even Miami, if some of that ramps up. And so the level of planning that's being done now is how would we look at that later if that occurs, and how do we create the right kind of comfort and protection for that kind of eventuality. And so that's kind of where we are in the planning. You know, as you all know, we're dealing with an unknown and at a rate that which we cannot see it increasing. And so we have to deal with the facts as they go and stay prepared enough for being able to provide solutions and keep people in place. It's very interesting too. And I only mention this, I see Dr. Barden on here, and so who I appreciate so much, but there's a wide range of opinion on lots of issues, and particularly even on the closing of parks that we have done and the emphasis that we want to use to protect people. And so there are some people who think, oh, no, we need people out and we need people healthy. We do want people out. We do want people exercising. We just want it distributed all over the city and the neighborhoods from which they live. The way we don't spread this is that we don't have people contact. That's where it's successful. I cannot imagine we'll be opening, even talking about opening parks until after the end of May, probably sometime in June. And it's probably good for people to get that in their expectation level, because they need to think about, what am I going to do in that period of time differently? And it's important that we keep them closed probably longer than we'd like as we go forward. So that's just kind of a tone of the city that I would encourage us to try and anticipate, so that we get good at doing what we're doing now and being creative. Anything else specifically, Tip, you'd like me to touch base on?
Just out of curiosity, what is your impression in terms of social distancing and how well the city is dealing with that? Are we dealing with—
I'd say at large, I think we're doing very well. Where it's not working well, we help encourage it, and LPD has been front and center in that. We approach that on a, you may not be informed, this is kind of what our expectations are. You're not an essential business. To keep it really simple, if anyone talks to you about this, if you're not on the essential business list, you're non-essential. If you want to do business as a non-essential business, then you've got to do it electronically where there's no people interaction. That's how you do that. And so if you can figure out a way that you can do that, and there's not going to be people next to each other, and it can be shipped to you or picked up at a place where it's sitting there for you, that's fine. But otherwise you're closed, and we can't be more lenient than that in this period of time. Our job right now is to protect people and protect lives and minimize the spread of the virus, period. All done. Nothing else.
Thank you, Mayor Mutz. And there'll be time for questions after the speakers have the opportunity of filling us in on what our situation is. From a perspective of philanthropy, Barney, could you give us your perspective on the role of philanthropy in our current situation?
I think there's a lot of opportunities for people to be generous toward this cause. I know that we're very happy that GiveWell and United Way have joined an effort, and it's an effort that we applaud. and we're looking forward to seeing what kind of requests they come in. So we can see if there's an opportunity for the Barnett family and other families to get involved in this and figure out where best to give the money. It's kind of confusing right now because you have all this money that's out there coming from the federal government, agencies in the state level. I'm sure the county and the city has a lot of efforts, and trying to figure out how to fill the void is kind of difficult at this time. I mean, we think that food is very important, and as Kelly Williams pointed out, that was the emphasis that Publix Charities put on it by getting the money out to the various feeding areas around the where Publix operates. And certainly we're worried about the mental health issue, and I'm sure we can hear from folks on this panel today that can tell us about that. And so it's just very difficult right now to figure out where the voids are and where we can best spend that money. And hopefully over the next few days, we'll be able to figure that out after we get these requests in from these various agencies around the United Way of Central Florida's geographic area.
Thank you very much, Barney. Relative to the campaign, I thought I should make a comment. I know I've had a couple of questions. United Way recently announced that it had sunsetted its campaign. Well, what does sunsetting mean? In essence, given this is a month where we would normally be wrapping things up and all hands on deck trying to get the last contributions through and the last campaign, workplace campaigns done, that didn't seem appropriate to the board of the United Way, and it didn't seem appropriate to me either. So rather than keep on pushing in these very difficult times, what we chose to do was to focus on those strategic things, like getting together with GiveWell to form the strategic alliance to maximize the impact that the United Way could have. Sunsetting doesn't mean there won't be a 2020, 2021 campaign. There will be. And it doesn't mean that the efforts of the staff, won't be driven toward that as we get out of this crisis. But that's what the sunsetting means. It means that we've decided to let's keep our eye on the ball. The ball is do the things that are important to see our ways through this crisis at this moment. Relative to agencies, I wonder if I could call upon Alice Kohler to talk about agencies and activities with the different service agencies. Alice?
Absolutely. Thank you guys for inviting us to speak. I am filling in for Cheryl Brown, who is the Agency Council, the Agency Directors Council President this year, and I'm her Vice Chair. She had a board meeting and an audit meeting this afternoon, so couldn't do this, but I do appreciate the opportunity to speak to you all about how all of this is impacting our agencies. I do want to preface my comments by first letting you know that I certainly have not personally spoken to every partner agency, but I have had an ear with quite a few, so I feel confident that my comments are on point. And if there are other agencies out there and I missed something, please put something in the chat box or raise your hand when I get through my agenda items. What I do know is that every agency is showing incredible resilience and dedication to their missions and continuing to provide support to clients within the scope of what is possible following recommendations and government mandates. We are all trying to reach outside the box and provide services remotely with respect to social distancing, or even pivoting our missions in some way to ensure that we are doing our parts to keep our communities safe. Most agencies, staff members are telecommuting when their missions allow for it. All agencies are facing extreme financial impacts, and we're all doing our best to pivot accordingly. Some examples of these financial impacts include decreased fundraising revenue due to canceled events. I know Campfire, LVIM, Alliance for Independence, and I'm sure there's other ones, have had to postpone their major fundraising events because they all fall in the spring. We're all looking at postponing those for the fall, but with so many unknowns, nobody's been able to set a date just yet. A lot of our donors are unable to donate. A lot of our mid-range donors, due to their job losses and hits to their savings and investment accounts at this time. Some agencies who rely on revenue from memberships, for example, are seeing financial impacts from that because their facilities have to be closed. We are all looking at what the impact of our 2020 United Way grants will be, given the impact on the campaign because of all of this. And I know some of us receive financial assistance from the half-cent sales tax initiatives from the Polk County Board of County Commissioners, and we're looking to the future at how that fund might be impacted down the road, given what economic impacts may come down the pike. Some agencies at this time are actually having to expend more in the short term to protect the safety and health of the community. An example of that would be, I'll speak to LVIM. We happen to be a health agency, so that might be more relevant to us than maybe some others, but we are filling prescriptions in our pharmacy for 60 and 90 days, which is more of an expense up front than it is over the time. So our cash flow is a little bit upside down at the moment, but that is helping our clients get the life-saving care that they need, and to make one trip instead of 3 over the coming time. Some agencies have had mass furloughs or layoffs. I won't speak to exactly which ones, but I know that there are several out there that have had to lay folks off or furlough their people. Many agencies are applying for the payroll protection program. It is quite a challenge on all levels, from the direction we're getting from the federal government, the SBA, and even the local banks. We're all asking the same questions at the same time, but I know a lot of agencies are putting in applications for that assistance. I did hear that our partner agencies out in Highlands and Hardy seem to be struggling a little bit more than our Polk County agencies. The technology is not quite as available out there, and they're having more trouble pivoting than we are here, it seems like. I do know that agencies are leaning on each other quite strongly. I know that when I've picked up the phone to call an agency director just for advice or to share a thought or get their thoughts on an idea that I've had, they are right there to answer my questions or share ideas back with me. And I know that when my phone rings, I answer it and I'm eager to give whatever support that I can to them. It's been an interesting time for sure for all of us. I'm happy to answer any questions that you have, or if there's if I missed something out there from any of my agency colleagues out there, please feel free to chime in.
And there will be an opportunity for questions following the next couple of speakers. Thank you very much, Alice.
You're welcome.
You've got a challenge. All the agencies have a real challenge on their hands, and the United Way and GiveWell are certainly here to try and do what we can.
Yeah.
Yes. Was there a comment? Okay. Next on the agenda, I would ask our chairwoman Greta Dupuy to talk about the United Way of Central Florida's activities, which are significant.
Thank you, Tip, and thank you all for your time today, for being on this call. I really appreciate Tip organizing this. I think it's so important for the community to hear from all these speakers on what we're doing in this community that we all are passionate about. As far as the United Way of Central Florida, the staff is working remotely, and they're following all stay-at-home orders and are actively responding to the crisis in a number of ways. So Bill and Ian, you'd be proud that United Way Central Florida, we are following your orders. But referral services through our 211 platform, which include but are not limited to childcare for the frontline professionals, first responders, medical staff, and essential employees. Also continued education, health, and financial stability courses through remote platforms. And we strongly urge for the quickest response, text your zip code to 898211. We are doing bi-monthly food distributions. They're continuing at 12 locations in food insecure communities throughout Polk County. All the sites have been converted to drive-throughs and are following the CDC guidelines for volunteer screening. Volunteer opportunities for the sites that need assistance are posted on the United Way Central Florida website at uwcf.org/VOL. They're providing emergency financial assistance to partner agencies working to serve our most vulnerable populations. And as Major Ian Floyd mentioned, the number of cases that we currently have in Polk County. There are also community resource opportunities. Please visit the United Way Central Florida UWCF.org website to get current and up-to-date resources that may be useful to you or someone that you know in the wake of this pandemic. They're convening our agency partners to understand needs, collaborate, and share as we respond to this crisis. Volunteer opportunities while your health, safety, and well-being is the first priority. We are continuing to receive requests on ways our community can help through this time, and we can't thank our volunteers enough for everything that they have done during this time. So again, please visit the United Way Central Florida website for those volunteer opportunities. And then also our community investment teams. We are still going, but meetings are continuing and have moved to Zoom meetings, just like this one, for April site visits in May, and we'll discuss and deliberate meetings through Zoom. So we are adapting to the new norm at the United Way of Central Florida, and definitely here for the community during the crisis.
Thank you very much, Greta. As mentioned earlier, one of the strategic initiatives that United Way of Central Florida and GiveWell have initiated is basically a joint venture to maximize the opportunity, to maximize the effectiveness that we can have from a philanthropic perspective on serving the needs of the community. Could I ask Christina and John to comment on that?
Sure, Tip. I'll be glad to start. First of all, I'd like to thank the United Way for inviting GiveWell to participate, and of course, everybody who's participating on the Zoom conference today. Obviously, we're going through a very difficult crisis, maybe not unprecedented, as your initial story suggested there, Tip. That was a very interesting story to listen to. But obviously a very difficult crisis that we're going through. You know, here at GiveWell, obviously our thoughts and prayers are going out to everybody that's been impacted. But you know, sometimes crisis brings opportunities, and we're seeing a lot of that around the country. We're seeing examples of people helping people. We're seeing a lot of innovative solutions out there. Mayor Mutz mentioned how Wesley Beck is changing some of his manufacturing lines to make masks. And I think that's a really good local example of something that's happening from an innovation perspective. We're seeing lots of community foundations and United Ways around the country raise money to help address this crisis. For us locally here, it's an opportunity for us to collaborate with the United Way of Central Florida to start the United Community Relief Fund. And I think it's really an important collaboration and something that can be a springboard for future collaborations. For now, the purpose of the fund is to aid nonprofits who are on the front line of dealing with this COVID issue. There's a lot of needs out there, food, shelter, just basic needs that we're hoping to raise money to meet. Right now, a lot of the efforts going into working with the United Way to raise dollars from GiveWell fund holders, United Way donors, and the general public so that we can build up this fund so that we can make it as meaningful as possible here for the community. I just started my job a week ago, so the fund really got started before I joined GiveWell. So I'd like to thank Lori Martini and the GiveWell team and Christina Kreiser and the United Way team for having the foresight to collaborate and get this fund going. And with that, I'll turn it over to Christina, who can provide some additional details as to the operation of the fund.
John, we appreciate that introduction, and what a first week you've had in your new position. We certainly appreciate your leadership. I've been asked to share a little bit more about the United Community Relief Fund process. As our teams rapidly adjusted to the growing pandemic, United Way and GiveWell conducted a needs assessment for local nonprofits, chambers, and other service agencies distributed through various channels throughout the Tri-County area of Polk, Highlands, and Hardee counties. Through that initial needs assessment, we identified the greatest needs at the time revolve around food, shelter, health services, medical equipment, protection, and childcare. We would also like to add that we expect these needs to change and adjust as we go through the situation together. From the needs assessment, a RFP was distributed throughout our channels once again. I'll ask Catherine to add that link in the chat box, but you can locate it on the United Way webpage and also through GiveWell. The first round of those applications are due Monday, April 13th. So as leadership givers and community leaders, we ask that you please spread awareness of this fund and that RFP opportunity with your local nonprofits. And I'd like to reiterate, it can be any 501c3 nonprofit human service program that identifies those needs that we previously discussed. To allocate those funds, both GiveWell and United Way of Central Florida will have representation. We, as United Way of Central Florida, will still use our team leads from the steering committees represented on the United Way of Central Florida side. This is certainly an adjustment to United Way's typical operations. I appreciate that we are constantly reminded by the United Way system that while COVID-19 will not change the mission we do, however, we must actively decide how it will change the way we complete our mission. And during a time of change and sensitivity, we appreciate this opportunity to partner with GiveWell to address our community's greatest needs at this time and to move forward in a positive light. I will close in echoing Alice's statements that she shared before, that our funded partners are extremely resilient. We've appreciated the opportunity to see how they're working together, how they are adjusting, and how they are serving those clients remotely with the funds that you all provide as leadership givers. And it is an honor to serve alongside of you all and our funded partners. We have seen our community members in the lowest of lows over the past few weeks, around the clock, but we also celebrate incredible highs, seeing our partners provide much needed relief and support during this time. United Way is in the business of identifying the greatest needs in our community, and we hope that you'll help us spread that awareness of the United Community Relief Fund. Thank you, Tip.
Thank you, Christina, and thank you, John. So we appreciate very much your time. We're a half an hour into this call. We don't want to make it too long. However, if there are some questions for any of our speakers or comments, we'd be delighted to have them. Any questions, please?
This is Barney.
I don't think it's gonna fit for me.
Sounds like another Barnett there. On Monday, when you get all these requests in, how are you going to evaluate those?
That's a great point. So we have identified those greatest needs to start off with. We realize that mental health and awareness will certainly be included in the health aspect. On our side, we have the community steering committee peers representing United Way of Central Florida. So we have the lead of our steering, our safety net team, the lead for our education team, the lead for our financial stability team, and the lead for our health team, representing our members. GiveWell, on the other hand, John, I'll let you speak to that.
Sure. Basically, we're going to have some staff and volunteers on this committee so that we'll have pretty much equal representation with United Way to evaluate the RFP responses that come back and make these funding decisions, as I said, based on those priority needs that have been identified.
And our goal is to rapidly distribute these funds. They will be coming from United Way of Central Florida, with GiveWell acting as the lead processor of the gifts. But we anticipate the need. I was just muted by the host, but if you can still hear me, we anticipate to have quite a bit of rounds of these applications for the community.
Thank you for that question, Barney. I see a question on the chat. It says, it's good to see everyone. One question, are all the cities doing the same thing? Is it so easy for someone to drive across city limits, congregate, and then the spread continues? Perhaps Mayor Mutz, that would be a question for you.
I think we are cooperating very well, all in all. Our goal is to make sure that we work together to keep things closed. And, but frankly, our focus has been so much on our own issues and people and needs that we have probably not been as involved across cities as we would be. We had some requests from Bartow today about some issues that Tony is working with them on, and we would have that same cooperation as we go along the way. But there are no other issues. Getting in, once we had the Safer at Home ordinance in place, or order in place, then we've been good.
Thank you, Mayor Mutz. I noticed that we also have a note from Elena Nis to everyone saying that the Peace River Center, peacerivercenter.org, has some resources in terms of mental health issues and questions. Are there other questions from the group assembled?
This is Ashley and Wesley. And one of our questions was probably to Alice or Christina, what are nonprofits doing to assist small business and the marketability of services to non-traditional clients?
That's a great point. Alice, do you want to speak to some of the remote work that you've been working on?
The question is about what are partner agencies doing to assist small business? I'm not sure across the board. I can speak to LVIM at the moment. At this exact moment in time, we are currently closed to new patients, given our volunteer staff is all safer at home. So staff is really running the whole operation at the moment. But on the other side of this pandemic, we are fully poised to be we've implemented a telehealth platform so that on the other side of this, we are foreseeing a greater need for our services given the change in employment status, or businesses who may need to cut expenses. They may be looking at cutting health benefits out of what they provide their employees. So we are getting ready to operate at more capacity on the other side of this. But I'm not sure about other agencies. I see some of our other partner agencies here. I don't know if it would be appropriate to open the mic up for them to comment.
Absolutely, surely. Any comment from the other agencies?
Hey there, this is Ileana Knis, and I just wanted to let everybody know we've actually moved all of our clients to telehealth or telemed. So all of our services are still open. And of course, all of our 24-hour services, such as our crisis stabilization unit in Lakeland and in Bartow, will remain open. We are a 24-hour resource. So our staff, following CDC guidelines, is wearing gloves, masks, and we're also taking the temperature of every individual that enters our doors. So although we are accommodating more and more telehealth, we are still seeing some on face-to-face. If our therapists feel comfortable, we have just made modifications as to how they do that.
Thank you, Ileana. I'm sorry for butchering your name earlier. Let's see, Ashley, was that an answer to your question? I did notice on terms of small businesses, I've seen some ad hoc efforts. For instance, I think Black and Brew is accepting donations for bringing coffee and lunches to healthcare professionals and some other things like that. Was that what you had in mind?
Yes, we were just really concerned about, like I said, non-traditional clients and making sure that our services are marketed well to those people that we traditionally wouldn't have in database, and make sure that we're taking every effort to assist every client.
Ashley, that's a great point. If I could add too, we've been working with Chris Ann Long through Bridge and Maximize Digital through the small business mediums, and trying to get more awareness for 2-in-1. I think we can all do our part to share. As you mentioned, that they're the non-traditional clients, but they have been faced with layoffs and furloughs and possible unemployment. So if we can get that resource out to those community members and support those business owners as they're going through this time of transition, we can help our community as well.
Thank you, Christina.
I'd like to add that as one of the food pantry sites, I know that we are distributing 211 information to the folks that come through our food pantry, and we are serving not just our own clients, but also clients from anybody who needs it. We almost doubled the number of families coming through this last time around. So those are folks that we don't see in our normal mission implementation, but we are communicating to them some of the other services that are out there as well.
Thanks so much, Allison. Thank you, Ashley, for the question. Are there other questions out there?
It looks like Lyle Phillipson has a comment. Lyle, can you
Go ahead.
unmute yourself?
Yeah, Lyle, can you unmute? Let's see. Maybe not. Maybe there's a,
It looks like Bruce Abels has a comment, so maybe we'll go to Bruce first.
okay, Bruce. Could you unmute, Bruce?
Now I'm unmuted. Yeah.
Yeah.
You know, this whole endeavor between the two organizations, I think is very interesting. And Tip, you and I have talked about this a little bit. The two organizations have both very, very different funding models, how the money comes in, how they raise it. And they also have a very different set of distribution models, how the money gets parceled out. I'd be very interested here as we go forward together on this, how this might affect both organizations in terms of a more shared giving model. I've always been, you know, from my time on both boards and been heavily involved with GiveWell and a donor on both sides. I've often been struck by the fact that these two organizations, as wonderful as they are, don't seem to have quite the history of collaboration that maybe we would hope for going forward. I used with Tip an example of the fact that I've never understood why the relatively limited investment funds that United Way has aren't in fact put under the professional management of GiveWell in a United Way account. It seems to me that's a symbol of mutual trust and working together. But whether it's today or going forward, I would hope we would hear more from Christina and John and Greta and the board chair at GiveWell about, is there anything we can do to get these two organizations to work together more seamlessly and to create projects and efforts that really help the community a lot?
Bruce, that's a great point, and I'd like to recognize that we have a couple of mutual board members, including Don Salvage, Kim Elmhurst, and Wesley Barnett, that have been encouraging partnerships and future opportunities to work together. It's probably more aligned with the planned giving and long-term investments like you and I have mentioned and discussed before, but we greatly appreciate that encouragement and we'll look forward to opportunities to work together more.
Yeah, I would hate to see this be a one-shot effort and then
absolutely.
When
And that's been,
we go back to business as usual.
Absolutely. That was important as we were setting up this fund, that we be set up in any future disaster, hurricane, tornado, any one of those factors, whether it's man-made or if it's nature, that we be prepared to serve this community in the future.
Good. Thank you.
Bruce, I'll add to that. I think it's a great point, and I think this collaboration that's been created as a result of this crisis is a good thing, not only for what we're having to do now, but for any crisis that might happen in the future. And I've been a longtime fan of United Way. I was board chair many, many years ago of the local United Way and a United Way donor. And I'm committed to communicate with Christina on a very regular basis and to collaborate as much as possible, because I think the two organizations together can do a lot of good for this community. So I appreciate you bringing that up.
Amen. Thank you.
That's a great comment, Bruce. And I know that one of the processes currently undergoing is the Strategic Planning Committee of the United Way of Central Florida is actively meeting to go forward. And of course, we began meeting on that committee before the coronavirus situation, but I think we will certainly take your comments on board as a valuable input. Thank you. Other questions?
Yeah, Tip.
I've received sorry.
Well, this is Tom Rushling. Am I on there somewhere?
Yes, you are.
Okay, just a quick question. Another group that's doing a lot of outreach are the churches. And I'm always curious about how closely we are in communication and coordinating with the churches who are just like we are. They're out asking all of their parishioners for help for the groups that they're connected with. So I'm just curious about that constituency and how we relate and coordinate with them.
Christina.
Yes, Dr. Urshan, that's a great question. Throughout this End Hunger initiative, the George W. Jenkins End Hunger initiative, we have actually been utilizing partners that are traditional partners and non-traditional partners. So some of our sites are hosted by local churches. We're also looking at opportunities to further serve the community with those hunger needs through some church partnerships in Highlands and Hardy County as well. So that's just a first step, but it is an opportunity for us to grow our footprint and also partner with other community leaders.
Thank you.
Thank you very much, Tom, for that question. Are there other questions?
Tip, I'm getting the same one question that is that's coming to me over and over again. And if you don't mind, I'd like to address it. It is, will this new fund impact the local United Way of Central Florida campaign? And the answer is absolutely. Unfortunately, this year is going to be one of the toughest years for United Way of Central Florida as far as collectible rates. But what we believe is that United Way is in the business of identifying the greatest needs in our community and addressing them by brokering the most appropriate nonprofit partners. And in a traditional sense, those that produce outcome measurements and have a history of producing those outcome measurements, which will all still stay intact during this time. But it will open it up to other nonprofit partners as well during this pandemic. Making this shift during this time of pandemic proves to the community and our donors that we are committed to that model and our mission of improving lives and strengthening the community. Short term, it will assist many of our partners that are in greatest need, but also as important, it will show and will grow, it will show our supporters and grow funds in the future towards a more typical outcome measurement model. I know that Penny Borgia is on this call, I could see her, and we want to reiterate that our traditional model is still as it is. Our CIT teams are working around the clock to allocate the funds from the campaign, but we do see this as not only helping our community with the greatest needs during this pandemic, but also for future campaigns, that it shows our donors, our investors, our volunteers, that they are making the greatest impact by investing in United Way.
Thank you, Christina. Yeah, and I think it can't be overstated that both GiveWell and United Way to Central Florida are about value add, and that's we didn't need to be doing things in campaign at the end of the campaign that would take away from value add. So I think it was a good move to suspend the campaign and a good strategic direction that we're talking about. Other questions? Is that a question? Is there a question there? If not, we're very grateful for each of you participating in this phone call. If you like the phone call and the content of it, we'd love to hear about it. If you didn't like it, if you have suggestions on what future phone calls could contain, we'd appreciate that as well. And Catherine Fitzwater at catherine.fitzwater@uwcf.org should be the repository for those comments. And we'll, where we did good, we'll try and do good again. And where we can improve, we'll try our very best to improve.
Absolutely. I think that Stacy Walsh was mentioning too, for those that don't know, YMCA has kept their doors open for frontline employees and associates so that they can continue to serve our community. I think that's extremely important for everyone to know, that YMCA has kept their doors open to those clients and that they are serving our community. And then also Stephanie Hoskins was reminding all of our nonprofit partners on the call, take record of your success stories, your deliveries, your wins. That will not only help you tell your story, but also apply for future grants and funding opportunities. So thank you for that reminder. That's a great reminder.
Is the YMCA principally childcare oriented, or what are those services that you?
Yes, we've closed our doors, and this is Stacy Walsh with YMCA, and we've converted all of our facilities to be childcare facilities at this time. We've served over 275 children so far have come through our 3 branches that we're utilizing. That's Lake Wales, South Lakeland, and North Lakeland at the time. And we're thinking that as we lift the safer at home order and people are able to go back to work, those numbers are going to, and the need is going to be even higher. So we're working with Polk County School Board, and we are doing mentoring with the kids and doing all of their schoolwork with them. We have them, some of them 13 hours a day.
And I understand that that ability to pay is not an issue.
Absolutely not. Nope. We have scholarships available. Nobody's turned away due to inability to pay.
Thank you so much, Stacy, for bringing that up. That's extremely important.
Thank you.
And then tip, Megan Hawks reminded all of us that if the mayor and commissioners are open to implementing a give to the charity of your choice, so we'll get more information on that, but I would like to recognize and celebrate all of our elected officials and appointed officials for mentioning 211 and the services provided by our partners through many of the calls that we've been listening to. I also see that Roxanne Bonta would like to remind everyone that Central Florida Speech and Hearing Center is calling on patients and letting them know that we are here and can still assist them. And I'm trying to catch up on all of these, but Carol Phillipson would like to ask Lyle to share on SCORE.
I'm not sure if Carol and Lyle can hear us anymore.
Okay.
Janet Deal reminded me, and thank you for that, of the United Way Relief Fund link, which is https uwcf.org/COVID-19 relief funds available. So that's, I guess that's available on the United Way website.
Yes, if you go to uwcf.org, so you don't have to remember too many links, you can find the volunteer information mentioned, the fund information, as well as the RFP. And we encourage everyone to please share this with your local churches or other nonprofits. They were sent out to everyone that we have and GiveWell has on our list, but we encourage everyone, if you know of someone and have a contact, please share and make sure they know about this opportunity.
Thank
And
you.
Bill Nutz added that mobile testing for COVID-19 will begin on 4/20 at the RP Funding Center. So thank you for that.
Great. Okay, we are now about 48 minutes into the call, and if there's any last question, we'll take it. If not, we will sign off with thanks. Any last questions? Okay, thank you all so much. We appreciate your involvement and your participation. Please provide some feedback to Catherine. We very much appreciate that as well. So everybody stay well, and thanks so much.